Yeah. So health awareness theme in January. One of the other health awareness themes is National Winter Sports Traumatic Brain Injury Awareness Month.
Yes.
Right.
And you know what? We have people in our lives, and we won't mention names. We have people in our lives that have suffered recent traumatic brain injuries with winter sports.
Yeah, totally. You know, interesting enough too is there's a nurse in the community. I just want to give a big shout out to her as well. Nikki Lawley is a pediatric nurse that basically suffered a traumatic brain injury. Actually, 3 of them. The last one that she suffered from was a work-related pediatric nurse. She got headbutted so bad that that was it. You know, she has a severe traumatic brain injury, and basically nothing worked. And cannabis.
It doesn't take much, right? Because how thin is that space between your skull and your brain? Your brain's just in this wash kind of floating around inside.
Yeah.
It's mushy. It's not solid, right? So when you get just the littlest thing, that impact.
Yeah. The bruised brain, and then what happens after. So we'll talk a little bit about that. But the interesting thing too, that I found about research was that research has shown that people who have a little bit of THC in their system at the time of injury are less likely to die than those who do not. So
there's some good research, and we're going to talk about it, Sherri, about how good cannabis is for the brain.
Just to review really quickly. Traumatic brain injury is a brain dysfunction caused by an outside force, usually a violent blow or an injury to the head. It can be a result of severe sports injury, car accident, regular accidents, headbutting, by accident. And there's 3 levels: mild, moderate, and severe.
Right.
So concussion has been known as being a mild traumatic brain injury. So it is still a traumatic brain injury.
It is. Your brain has still been injured.
Exactly. So there's 3, and we can go over them really quick. Mark, you want to go over them with me?
Sure. Ready? Let's go with mild traumatic brain injury symptoms. So loss of consciousness, you may or may not lose consciousness, being dazed or confused, dizziness or balance difficulties, weakness or numbness in the arms and the legs, headaches, nausea and vomiting, drowsiness or an increase in sleeping, which, that's one of the things that you watch for when somebody has a traumatic brain injury. When somebody hits their head, you really got to watch them for the next 24 hours for sleepiness. It's one of the things you really watch for. Sleep disruptions, restlessness, blurred vision, ringing in the ears, changes of smell, memory problems, difficulty concentrating, changes in mood, anxiety, and depression.
Really, really interesting. Really, the brain is so powerful. And just think of all the receptors that we have in our brain. The CB1 receptor is most abundant in our brain, which cannabinoids work. So the next one, moderate to severe traumatic brain injury. So just imagine all the symptoms that Mark just talked about, plus a lot of patients can have prolonged loss of consciousness, anywhere from minutes to hours. Patients have persistent worsening headaches that don't go away. Patients can have worsening nausea and vomiting. A lot of patients experience seizures, that pupil dilatation, so big giant pupils in one or both eyes. Some patients have experienced fluid coming out of their nose or ears, difficult walking, weakness in toes and fingers, numbness, tingling, coordination difficulties, extreme confusion, agitation, combativeness, slurring of speech, and coma. So that's severe.
Right.
Can you imagine a plant being able to truly help with that?
It truly can help. So what are some of the treatment modalities? Well, rest, number one. You really just need to rest. You can't tax your brain. You really shouldn't, you shouldn't be on the computer or reading, whatever. You should just rest. There's medication. There are some pharmaceutical medications that they'll give. Surgery. Sometimes if it's a severe traumatic brain injury, they might have to do surgery to correct any of the issues that are going on. And here's the big one, cannabinoids. Yes.
So here's the interesting thing too. So when people have traumatic brain injuries, oftentimes it is days after where people start to have worsening symptoms. So if you think about it, the body releases these toxic chemicals that can further be damaging the brain. So it causes this oxidative stress, the inflammation. The brain is constantly firing, right? And so oftentimes too, these can cause what they call a neural death, even after the person is stabilized. So this can cause more damage than actually the original injury. how cannabis as a treatment, okay, we'll talk about this now, we'll get into it,
Do it.
minimize secondary brain damage that happens after the original injury.
Yes.
Right?
It can interact with receptors that may help the body from releasing the cytokines, which cause inflammation. Yeah.
Neuroprotectant, so here's the other thing too. What about the benefits of cannabinoids for symptom management? I mean, just think of that.
Just the symptoms themselves, not even, but the most important thing is, of course, the neuroprotection and the decrease of inflammation. But these other things, right? That's the beauty. That's the beauty and the amazing part of cannabis, right, Sherri, is that it doesn't just do one specific thing. It'll hit like 4 or 5 things
All
that
at the
you're
same
having
time.
going on all at the same time.
So
Yeah.
that's the part that's so interesting too about cannabinoids. If there's a benefit for symptom management, and just some of them. And you think about the umbrella concept. The umbrella, when we educate on the endocannabinoid system, is our body. All of the spokes of the umbrella represent different organ systems, body systems, and it just to show the interconnectedness of it, right? And so basically the benefits of using cannabinoids for symptom management to decrease nausea, improving people's appetite.
Right. Decrease depression. It'll improve your mood.
Decreasing anxiety. It will improve your mood even more.
Yes. And decrease insomnia. You get improved sleep. And let me tell you, you need to have good sleep.
Yes.
So what types of cannabinoids are we going to be looking at when we're talking about treating or actually helping to alleviate some of the symptoms of a traumatic brain injury?
Well, we love whole plant, right? It has the terpenes, it has all of the antioxidants, the bioflavonoids, the cannaflavins, right? All of that. But basically, both THC and CBD, but preferably CBD dominant. And this is because CBD interacts with so many of the brain neurotransmitter signaling systems.
Right.
Dopamine signaling, serotonin signaling, opioid signaling. THC works great too. But basically, studies have shown that the CBD dominant can be a little better, as well as with the terpenes, beta caryophyllene and terpylene, which we talked about last week.
Yep. And THC and CBD mimic our internal endogenous cannabinoids, which can, again, prevent the release of cytokines. So cytokines are pro-inflammatory and that can cause increased damage to the brain. And again, Sherri talked about it earlier. It's not necessarily the original injury that's the problem. It's the following days afterwards where this continuation of, the body's reacting, trying to do the right thing, but it causes inflammation and that's more damage to the brain.
Yes. And so we have also this toxic molecule called glutamate that can be released. It decreases the glutamate, and this can be released after the traumatic brain injury. So the other thing too that THC and CBD can do is also reduce the swelling of the brain and any neurological impairment that may be occurring, and also reduces brain cell death.
Okay, other therapies, because you know what? We like to talk about all sorts of things that affect the endocannabinoid system, the ECS.
Yep. So diet, we always talk about diet. High fat, low carbohydrate, low sugar diet with plenty of leafy greens and omega-3 oils, that DHA-EPA ratio, and fermented foods that have probiotics in them. So let's get back to the endocannabinoid system. Our enteric nervous system, which is our entire gastrointestinal tract, our central nervous system interact with one another via the endocannabinoid system. So it makes sense that everything that you put into your mouth is going to affect your brain.
Science. So for folks who don't know, your enteric
nervous system
is your gut. It's all of the nerves and the nervous system associated with your gut, right?
From
your organs. and it operates on its own, by the way. If you happen to have an injury and you're brain dead, like you're clinically brain dead, your enteric nervous system is still operating 100% just fine on its own. So when somebody says, trust your gut feeling, you better, because it's actually a thing.
It's a thing. And it's just so fascinating. So other things that can complement traditional therapies and cannabinoids are nutritional supplements and antioxidants. Specifically magnesium, vitamin D, curcumin, glutathione, and melatonin to restore circadian rhythm and sleep.
And of course, acupuncture and neurofeedback. Those are two other modalities that'll work really, really well.
If you or someone you love is suffering from chronic illness, chronic pain, If you or someone you love is interested in learning how to incorporate cannabis into a wellness regimen, or if you or someone you love is interested in having an adult use safe recreational experience, reach out to us. We're so happy to educate you and empower you to use this plant in the
Yeah.
best way possible for you.
Yes. Yes. You know what? If you're a healthcare provider, anywhere in the healthcare spectrum, we talk about all these different modalities, acupuncture, massage, anywhere where if you're helping people to be healthy, join us. We need you in the community. We need your energy. We need you here, and we will help you understand how to integrate cannabis into your practice. So join
Absolutely.
us, the
Yep.
Green Nurse. Yeah. All right, folks. Much love. Happy Inauguration Day.